What is LSD? LSD, or lysergic acid diethylamide, is a psychedelic compound derived from a fungus that infects rye grains. It is known for altering perception, mood, and thought processes, often leading to hallucinations at higher doses. Additionally, it is considered an empathogen, which means it enhances feelings of empathy and social connection. Research into LSD as a potential treatment for mental health conditions began in the 1950s. However, studies largely halted in the late 1970s due to legal restrictions, particularly the US ban on LSD in 1966, as well as stricter regulations for medical trials. Interest in psychedelics resurfaced in the mid-2000s, leading to new studies on how LSD might help people shift their thinking patterns and reset habitual ways of processing information. Though the precise mechanisms remain unclear, LSD appears to influence serotonin and dopamine, two neurotransmitters that regulate mood. Early research suggests the drug could be beneficial in treating conditions such as depression, post-traumatic stress disorder, substance use disorders, and anxiety in individuals facing life-threatening illnesses. Several studies have investigated the potential therapeutic benefits of LSD. One study found that a single dose improved mood and optimism in people without a history of mental illness for about 2 weeks. Another trial focusing on patients with life-threatening illnesses revealed that nearly 78% experienced reduced anxiety and about 67% reported an improved quality of life. An analysis of 7 different studies on psychedelics, including LSD, psilocybin, magic mushrooms, and ayahuasca, showed substantial reductions in depression and anxiety. Though short-term side effects such as headaches, nausea, and increased heart rate were noted, researchers concluded the benefits outweighed the risks. LSD and alcohol dependence research dating back to the 1960s and 70s suggested that LSD may help people struggling with alcohol addiction. Studies indicated that individuals who took LSD experienced enhanced optimism, positivity, and an increased ability to tackle challenges. In some trials, a single dose was associated with a significant reduction in alcohol use for 2 to 3 months, with effects lasting up to 6 months in certain cases. However, the benefits diminished after a year, and further research is needed to better understand LSD's long-term impact on addiction treatment. How is LSD used in therapy? LSD-assisted therapy is conducted in a controlled setting under the supervision of a trained medical professional. During the session, the therapist provides guidance and support while the patient experiences altered consciousness. Despite the drug's strong effects, patients can recall their experiences clearly afterward. Some therapeutic approaches incorporate music to enhance the emotional depth of the experience, helping individuals confront fears, process emotions, and gain personal insight. While LSD can promote emotional growth, using it outside a medical setting increases the risk of distressing experiences. A sober companion or trip sitter can help mitigate these risks. Challenges and unknowns in LSD therapy. Although LSD-assisted therapy shows promise, much remains unknown. For instance, some individuals with certain mental health conditions may not respond well to psychedelics, as they can exacerbate symptoms. Future research may focus on refining therapeutic methods to maximize positive outcomes while minimizing anxiety. Currently, LSD therapy is not approved for use in Australia, though other psychedelic treatments, such as MDMA and psilocybin-assisted therapy, have been authorized for certain conditions. Other psychedelic research recent studies have focused more on psilocybin, which has demonstrated potential for treating addiction, including alcohol and tobacco dependence. Psilocybin is often preferred due to its shorter duration of effects and reduced stigma, making it easier to obtain funding and regulatory approval for trials. For further reading, check out articles on the therapeutic potential of magic mushrooms and MDMA-assisted therapy for PTSD.